2.5 year, 3-year-old child still on the bottle, saying that कि ये तो कुछ और खाता ही नहीं है, हम क्या करें, अब कुछ खाता ही नहीं है, दूध तो जाए इसके अंदर, right? I would advise the mother to throw the bottle out of the house.
Exactly.
And believe me, कोई बच्चा ज़्यादा देर तक भूखा नहीं रहता.
Permanent teeth है, वो injure हो जाता है या टूट जाता है. ऐसे cases में what a parent should do at that moment?
This is a dental emergency.
X-rays बहुत होते हैं, dental X-rays, वो भी एक
Unnecessary exposure should be avoided.
coming to the cavities.
Dental caries is a communicable disease, but it is a transferable disease.
Transferable.
Yeah, to such extreme levels that the child has to be hospitalized.
Hi and welcome to the brand new episode of Shine with Swati podcast. So today I have with us Dr. Bharat Suneja, who is into pediatric dentistry and has the experience of 20 years for now. And the way he handles kids, I think he's one such dentist where kids, they really look forward to meet the doctor. They wait and ask, ki, when is our next appointment? So this is some breakthrough achievement which I think is for kids. And today we have with us Dr. Bharat Suneja, did his post-graduation from Christian Dental College, Ludhiana. Right. And we are honored to have you here, sir. And thank you for coming to the show.
Thank you so much, ma'am, for such a warm introduction.
So it is like, sir, I know you personally, as in because my kids are really, really fond of you. And generally, dentist, हमारे time भी it used to be like कि dentist के जाने, oh no, pain नहीं भी होती, anticipation में pain start हो जाता है कि नहीं जाना, but I've seen a major shift, the kids are like कि hi मम्मा कब जाना है, one हमें वहाँ पे gift भी मिलेगा after the treatment and second हमें ice cream खाने को मिलेगी. वो तो फिर भी side वाले things हैं, but the way they go and vouch on your dental chair and they're so excited to meet you is something, you really have cracked the kids' psychology. So today I've changed this pattern a bit. हम start करते हैं basic से and then how to go about it. Today I think I wanted to start with the basic misconception कि जो हम में भी था, which actually stops parents or us for bringing the smaller kids to dentist. हमारे मन में हमेशा ये रहता था कि बच्चों के दांत तो मिल्क टीथ है, वो तो चले ही जाएंगे. So why इतने छोटे बच्चे को डेंटिस्ट पे लेकर जाना? So I'm sure you must have faced it a lot.
Yes. So this is one of the most important questions that needs to be addressed. And it is my realization, and I think all the parents, the society in general should change their attitude towards us. Because milk teeth are primary teeth. They are the basic teeth which the child uses for eating, for speaking, for so many other functions.
Gee.
And once they get cavities, that doesn't mean that only a part of the tooth is gone or there's a hole in the tooth which can be built or not built later. It means that there's an infection in the teeth.
Yes.
It is a bacterial infection.
Yeah.
We need to be curing it and we need to be treating it. Filling these teeth is a part of that correction. Right? It is not complete, but we have to have a very holistic approach towards treating the child's teeth or treating the child's children, because cavities is just a problem, is just a part of the problem. It's not the problem as such.
Right. And I remember जब ये चीज़ था ना, आपने एक बहुत beautifully explain किया था कि we forget that permanent teeth are lying there, no? And जो infection है somehow...
Yes. So permanent, we are not just treating primary teeth or permanent teeth. We are treating the mouth as such.
Right.
So we are treating the environment so that the teeth are there in the healthy environment. We want to give your child a healthy mouth. And that is irrespective of the fact whether the teeth are primary or whether they are permanent. Right?
Okay.
Even when permanent teeth come in an unhealthy environment, they'll tend to have cavities and they will also tend to have pain. So it has been seen that children who have a bad oral hygiene while they had milk teeth will have a bad hygiene forever, even when they are adults. A study has shown that children who had bad teeth are the adults who have bad teeth. So it is that significant a relation.
Exactly.
Because the mouth has always been unhealthy. So why not tackle it at a time where it can easily be treated and where it can be prevented?
Bilkul. So it is actually like, we should actually start our dental checkups very early, so that first of all कि कभी वो जो unhygienic conditions हैं वो आए ही नहीं, right? So now coming on to कि once कि वो parents को जो एक conviction चाहिए कि okay let's we अगर छोटे बच्चे को दिखाना है to our मतलब उनकी dental health दिखानी है, so what is the right age जब या what are the right indications कि अब हमें dentist
Okay.
के आना चाहिए?
So there is indications come later. Indications, there has to be an early start to this. So the right age, which I advise all my patients or their parents, is that it should be around his first birthday.
Okay.
A lot of people are surprised by that, right? First birthday and you take the child for a dental checkup. But that's correct, because that is the best time when we can be giving some anticipatory guidance to the parent, right?
Okay.
Because this is the time when the child is moving off from breastfeeding, from mother's feed to the other foods, and this is there is a change happening, and this is the time when habits can be inculcated without the child realizing it, right? This is the time when we should be starting to brush the teeth. This is the time when we should realize that the child should not sleep with the bottle in the mouth, or should not sleep while taking the mother's feed also, right?
Okay.
Mothers usually feed the child to make him to go to sleep,
Yes.
right? But that's not correct. We feed the child when the child is hungry. Of course, a lot of time overlaps it with his sleeping time also, but we need to be remembering that while the child is sleeps off while taking the feed, a lot of the milk, whether it's from the bottle or whether it's from the mother's, it collects around the teeth, it pools around the teeth,
Yes.
and it will stay in the mouth while the time the child is sleeping. So I'm not saying that we stop breastfeeding at 1 year of age, or I'm not advocating anything of that sort. All I'm saying is, after the time the child is fed, please clean his teeth, right?
Okay.
How to clean that teeth? You can't expect in the night that to brush the teeth.
Of course.
The children are fed sometimes 4 or 5 times in the night,
Yes.
right? But at least keep a clean towel or a wet tissue just next to yourself so that you can wipe off the teeth before he goes to sleep. Or
Okay.
maybe give him some water.
Okay.
So ideally it would happen that slowly you start shifting as the child grows, like 1.5 years, you start shifting to the habit of that the child has a last heavy meal, or even his last milk before he goes to sleep, and then he continues to sleep for a long time. Then morning when he gets up, brush his teeth, and then has the next meal.
ओके सो अगर बाय चांस जैसे अब ना ये एक बहुत ज़्यादा कॉमन है और बहुत प्रेवलेंट है कि बच्चा दूध पीते पीते या बॉटल के साथ या मदर्स फीड के साथ सो ही जाता है, राइट? नाउ अब एकदम से इफ़ वी से ये हैबिट चेंज करना इज़ नॉट दैट प्रिटी ईजी. मे बी फॉर न्यू मॉम्स दे कैन बी मोर अवेयर कि किसको कैसे अवॉइड करना है, बट जहाँ बच्चे की आदत बन चुकी है, राइट? सो देयर दे शुड एक्चुअली टेक द वेट टिश्यू और वेट टॉवल. सोते हुए बच्चे को भी क्लीन कर सकते हैं.
Yeah, we can clean. Or we should at least check that there is no milk in the mouth. Just lift the lip and see whether there is milk, remnant of some milk around the teeth or not. Only front teeth, actually. You might not be cleaning the rest of the teeth, because basically it is in the upper front teeth that maximum problem starts. So just clean them before he is sleeping, before he goes off to sleep.
Right.
So, or give him some water, if not anything else. If you have a milk bottle, also have a bottle of water alongside, right?
Nice. That's pretty doable and practical.
So just have some water, so that, because milk, whether it's mother's milk or whether it is bottled milk, it contains natural carbohydrates. If it is bottled milk, we would be adding sugar to it, right? That adds to the problem.
Right.
So nursing caries is a big problem, right? Because these days and I've seen a lot of mothers or parents, 2.5 year, 3-year-old child still on the bottle, saying that कि ये तो कुछ और खाता ही नहीं है, हम क्या करें, अब कुछ खाता ही नहीं है, दूध तो जाए इसके अंदर, right? This is, I'm not debating that, but that does not mean you prolong a habit till the time it gets really unhealthy for the child, right? So what has to be done? If it is at a 2.5 to 3-year-old child, I would advise the mother to throw the bottle out of the house.
Exactly.
So if it is going on for that long, it is best, because if it is available, the child will cry, you will eventually give in.
Definitely.
You will eventually give in. And believe me, कोई बच्चा ज़्यादा देर तक भूखा नहीं रहता.
Right.
He would take something or the other. And the
Yeah.
more we delay the change in this habit, the more it becomes difficult, right?
Yes.
It becomes really difficult after the age of 4 years, 3 years to 4 years to change a habit. But if it
बिल्कुल.
has been done at around 2 years of age, that is much more easier.
Undoubtedly.
Yeah.
Yeah, this reminds me as well, I think it's that hard call जो एक mother को लेनी चाहिए और लेनी पड़ती भी है for that matter. And I had to get rid of my daughter's bottles,
So,
and I
and
remember.
another thing that I would want to mention at this stage is that there's a lot of it is prevalent in our society, especially when mothers are being with the child for so long, that they use the same utensils or the same spoons to feed themselves as well as the child. It's sharing spoons, right? So they would be wanting to feed the child with some semi-solid food just to check the temperature or to check the sugar content or check how it tastes. They would first put the spoon in their mouth, and then with the same mouth,
Same
same
spoon.
spoon feed the child as well, right? The mother obviously thinks there's no barrier between the mother and the child, but in the process doesn't realize that she's also transferring bacteria from her mouth to the child's mouth if her mouth also has those bacteria. So parents need to be
Yes.
aware of this, right? So
Exactly.
somehow we have to prevent the entry of these bacteria into the child's mouth. Once they are
Right.
there, they will get established.
Right. I mean, बहुत what you pointed is actually बहुत simple है कि
Yeah.
mother पहले
It is
check
very
कर लेती
common.
है. It is
It is
very
very
common.
common.
And here it is that alarm, yes, कि ये नहीं होना
Yeah,
चाहिए.
it should not be done. It should not be done.
Right. Right. So thanks for highlighting it. I know, and it's very important कि हम ये message put across करें.
Yeah.
Yeah. Now coming to the siblings as well.
Yeah.
Yes, है ना? तो उसमें I remember it is I think this cavities and everything is communicable as well.
It is, to an extent, it is. We do not classify dental caries as a communicable disease, but it is a transferable disease.
Transferable.
Yeah, it can be transferred from one sibling. This is known as horizontal transfer. It can be transmitted from one sibling to the other and even from the mother to the child. Right?
Right.
Although this is not the only factor, there will be so many other factors. It is dental caries is like a lifestyle disease, like you have heart disease. It can be prevented if you take a lot of good lifestyle measures. Similarly, dental caries, although bacteria are involved in it, it is also a kind of lifestyle disease where
True.
if you change the habits, if the family changes the habits, a lot of cases we are able to prevent it to a large extent.
Right.
I'm not saying 100%, but
Of
definitely
course.
to a large extent.
Right. So even many a times sibling also share their things.
Same thing.
So even the bacteria can travel to the
Absolutely,
siblings.
absolutely.
Because I still remember it happened in my family for that matter. And you had that pointed that it is because it started from one
Yeah.
and now everybody has the
Yeah.
cavities. Yes, I totally go by it, and the practically I've faced it for that matter as well. So coming back to the dental care which is needed, जैसे कि birthday पे when child turns 1 तब उसको first checkup करवाना चाहिए, right? Now coming on to first brush कब करवाना चाहिए और paste कौन सी introduce करवानी चाहिए, so
Okay, I'll just elaborate on this. Brushing should be started as soon as the first teeth comes into the oral cavity, right? So that would be 6 months, 7 months, 8 months. Whenever you see the first teeth, it has to be cleaned, right?
Right.
So whether you do it by a regular brush or now these days small silicone brushes, finger brushes are available. So whichever, it has to be brushed. It has to be cleaned after a meal or at least twice a day, right? Now, there are a lot of parents or mothers, they ask me this question ki paste kaun sa use karna hai? We want to give him the best paste and we have imported some paste from the US or some relative. We don't use these regular pastes. All I would want to say is, we want to give a fluoride free paste to our children.
Yeah.
Right? So this concept is totally wrong. Children need a fluoride toothpaste.
Now this is very
But
important.
they do not need to swallow that toothpaste.
Yes.
Right? So that is the distinction. The problem is when the child swallows that toothpaste, and that will happen when you put a lot of paste on the toothbrush. So the paste on the toothbrush should not be more than a rice grain. Just a smear. बिल्कुल एक तुपका जिसको कहते हैं ना, you should just be able to see that amount of toothpaste.
Right.
इससे ज़्यादा नहीं.
Oh,
इससे
okay.
ज़्यादा अगर हम देंगे तो बच्चा swallow ही करेगा. It is of no other use. And it will only make the child uncomfortable and he will want to spit and rinse immediately.
Right.
A lot of mothers say that कि बस 1 सेकंड के लिए ब्रश करता है, इसके बाद तो ये भाग आता है. I just can't do. That is because it is not, maybe it's not very pleasant for the child कि इतनी frothing मुंह में हो रही है, वो कितनी देर माउथ में रखेगा. Right? Have a very small amount of paste.
Right.
Let the child brush for a long time. Right? Let him clean all the surfaces, all the sides around for a few minutes. Right? It is good that the paste stays on the teeth for a longer time because it contains fluoride. That is the therapeutic agent. That is what we would want to stay. And it is not harmful. It is not at all harmful. Only if the child swallows a huge amount every day, there's a possibility of some harm. That also has not been proven.
Okay.
Right? But the regular paste that you would be using, that the parent would be using, which is any regular...
so it can be started as soon as 6 months because
as soon as
tooth काफी बच्चों के...
Yes, as soon as the first tooth comes.
So,
clean it.
Because maybe 6 months का जो बच्चा होता है ना, we are not sure कि वो swallow करेगा कि spit करेगा. They're too...
Yeah, so that is why उसको quantity ही इतनी कम लगानी है कि just it covers the tooth. If it's just 1 or 2 teeth at that
so
time,
it will be just
a bit. Just it covers the teeth. You wipe it off. Maybe we have a sterilized cotton bud, like a Johnson's bud, earbud that you use. If you can just use that. Just to first just apply the paste and just wet it and just clean it.
Oh,
that's
okay.
it.
Yeah, that's pretty...
yeah,
इसमें swallow करने के chances भी नहीं.
Swallow नहीं करेगा. हम ज़्यादा पेस्ट देंगे तभी swallow करेगा बच्चा.
True. And वो जैसे वो ads में दिखाते हैं ना, वो बड़ा सा ऐसे निकलता है. So वो सबको वही
concept.
Exactly.
Nobody needs that amount of toothpaste. Even adults would not need that amount of toothpaste.
So adult would require
a pea-sized maybe. Right?
So
a pea-sized maybe. Right? Children, we would say a rice grain. For older children, maybe a pea-sized, and even adults, that much is enough. You do not require the full ribbon that covers the length of the toothbrush. You don't require it.
You really don't require it. So it's basically done by the marketing gimmick.
Yeah, absolutely.
By
absolutely.
the, कि ज़्यादा use और ज़्यादा.
And also by this thing that जितना ज़्यादा देंगे बच्चे को, maybe it is good for him. So
boy, it is harmful.
It is harmful, yes.
Yeah. So, I mean, yeah, that is important because I even had a debate with somebody, you know. So मेरी टूथ पेस्ट फिनिश थी और उन्हें पूरी लगा के थे. इतना सारा कौन लगाता है? तो कहते ऐसे तो होता है.
अच्छे से क्लीन करना है तो ऐसे
होता है. So yeah, I understand that. So now, you know, we covered that कि इस एज से डेंटल एंड वंस यू नो जो हमने अपने जो फर्स्ट बर्थडे पे जो फर्स्ट चेकअप होना चाहिए, दैट इज़ मोर अबाउट अवेयरनेस, है ना. दैट इज़ अ सॉर्ट ऑफ एन अवेयरनेस चेकअप. एंड so are there any indications as well ki let's say awareness checkup bhi hua, everything seems to be perfectly fine, and then there has to be some particular, you know, age again, the gaps ki dobara checkup kab hona chahiye?
Every 3 to 6 months. Every 3 to 6 months a child should have a dental checkup. Now at this point I'd like to add something more, that a lot of parents think that if the child is not complaining of any pain, the child's mouth is healthy or there is no dental problem.
Yeah.
Right? So that is not the case. The child would have pain only if the dental disease is too advanced. Right? If it has reached a stage where it cannot be corrected by normal measures, by our normal dental visits, we'll have to do something more advanced dental work for this child, which the child might find it slightly difficult to go through.
Yeah.
One, because he's a child, he's a small child after all. And secondly, if he's in pain, to work on a child who's in pain is difficult. It is difficult for the child also to accept that.
Right.
So what we should be doing is that getting the child for a regular dental checkup so that the problems are caught on at an early stage. We can maybe solve this problem just by a small filling or a small sealant. But if the child has had a pain or an abscess or a swelling, then we will have to do a root canal or maybe extract the tooth.
Yeah.
Right? So why let it, not that it cannot be treated at that stage, but why let it reach that stage?
I know,
so the focus has to be on prevention. He's a child patient. He's a child. We want to prevent any sort of problems or any sort of diseases that child might have.
Okay. So preventive visits should be done like 3 to 6
3
months
to
or
6 months, definitely 6
की
months.
gap पर.
For some children who are prone to get dental cavities, we would advise every 3 months. But
Right.
for a child who generally has a healthy dentition, at least every 6 months.
Every 6 months they
Yeah.
should they should come whether or not
Whether
pain
or
hai
not
ki
they
na.
have a problem, they just need a dental checkup. And you should
Right.
prepare the child also accordingly, right? To
Right.
get a child to a dentist, to prepare the child to getting to a dentist, if he comes just for regular dental visits, is very normal. It should be very normal for the child, right?
Yeah.
It should
Right.
not be that we are getting the child only in pain.
Yes.
And sometimes it also happens that it is prevalent in our society that mothers would tell their children that ये कैंडीज बहुत ज़्यादा खाता है, विल टेक हिम टू द डेंटिस्ट, इंजेक्शन लग जाएगा.
Yes.
अब या
So
ये ब्रश नहीं अच्छे से करता, डेंटिस्ट के पास लेके जाएंगे, इंजेक्शन लग जाएगा. अब डेंटिस्ट के पास आएगा तो उसको डर तो लगेगा ना बच्चे
तो
को.
पहले इतना नेगेटिव इमोशन जोड़ दिया
He will
है.
definitely be scared. He's
Yeah.
not had a dental experience of his own, but
Yeah.
still he's scared
Yes.
because he's heard of so many things about the dentist कि यहाँ तो इंजेक्शन ही लगता.
Yeah.
So prepare the child to get into the dentist just like
In a very positive
very
manner.
positive manner कि सिर्फ आपके teeth count करेंगे. They'll see कि कैसे अच्छे से ब्रश करना है, ब्रश करना अच्छे से बताएंगे, and you'll get a small gift also after that. That's it.
Yeah.
That's it. And the child will start looking forward. He'll have a sense of achievement after the dental visit.
बिल्कुल.
कि मैंने अच्छे से दाम दिखाया, I got something, so I look forward to the
So
next
that's
time.
how, अब जो being a pediatrician dentist, I think, where you really work around kids psychology, and it is a very important message सारी moms के लिए कि बच्चे को डेंटिस्ट पे लाने से पहले एक मेंटल मेकअप जो है ना, एक वो बहुत ही पॉजिटिव डायलॉग एक रखना चाहिए, राइट? सो आई वाज अबाउट टू कम टू दिस, कि हमें अब पता तो चल गया है कि 3 to 6 months हमें डेंटल विजिट करनी चाहिए, बट देन किड कम्स विद लॉट ऑफ एंग्जाइटी ऑलरेडी, एंड उसका रूट कॉज भी आपने भी बहुत अच्छे से एक्सप्लेन किया. बट येट देन जब उसका एक मेंटल प्रेपरेशन है, उसको ऐसा ही है जब ये सेट कि आपके टीथ number of teeth count karenge, then you will get some reward out of it, maybe.
Yeah. So we also have a role in it. Definitely, the way we handle children or the way we treat children will definitely have a role in it.
So I want you to please come up with that. Yeah.
So what do we do in the first visit? In the first visit of the child, we normally never do any aggressive treatment. Right? We would just want to desensitize the child. The child in the sense that he's very comfortable on the chair. We would show him all the instruments that this is यहाँ से पानी आता है, यहाँ से हवा आती है. There's a suction tip which we show it. This is like a magic pipe. How does it feel in the mouth? It's like a straw. So the child would himself hold the suction tip, put it in his mouth, and be comfortable there. Just get a feel of what does it feel to be worked on in his mouth. Right? Otherwise, if we start doing treatment in the first visits, just the newness of all these sensations makes the child very anxious, and if the child refuses once, then it is very difficult to get him again to get the dental treatment done.
Bilkul.
Right? So the first visit we just take to desensitize the child. Like we'll show him everything, we'll talk to him and this thing, and then we'll get a promise out of him that yes, next time we'll clean this tooth or we'll make it white, and we'll show him in the mirror that look, all these teeth are black. Now we want to make them white. Would you like white teeth or would you like black teeth? So that's how we work on the child psychology. And the next visit we expect most of the times the child is very positive about it.
Yes.
Right? If he goes, that is a sense of achievement which we dentists or we pediatric dentists have, that when the child is leaving our clinic with excitement.
Yes.
With excitement, with that yes, I got this and मेरे teeth भी clean और मैंने बहुत अच्छे से कराया. Very brave. The dentist told me I was very brave.
Yeah.
So this is how, and this is how he will not neglect his health also. Exactly. The purpose is not that he comes back to us. The purpose is that he does not neglect his dental health.
Yes.
Because for children, they would blank out their dental health if they've had a bad experience. They would not tell their parents कि they have a dental problem, कि यहाँ पे पेन हो रहा है, वो दूसरी साइड से खाना स्टार्ट कर देंगे.
Okay.
वो दोनों साइड से नहीं खाया जा रहा, वो कुछ सॉफ्ट चीजें खाना शुरू कर देंगे जिससे पेन नहीं होगा, but they will not tell their parents.
Okay, कि वो इतनी
yeah,
डर
so
और
they will
anxiety
just
बैठ जाता
keep
है.
on prolonging it. They will just blank it out.
Okay.
If they've had a negative experience, कि somehow हमें डेंटिस्ट के पास नहीं जाना पड़े. If we tell our parents कि यहाँ पे पेन है, so they will naturally take us to a doctor.
Right.
And there they want to face that situation.
Right.
It's a very normal child reaction. It is nothing
Okay.
unusual about
It's
it.
probably, I'd come to you only, and my kids have a lot of good, feeling. They themselves ask me कि मम्मा हमारी next appointment कब है?
Yeah.
So it is,
That's so
I
sweet.
had not faced that thing, so it is pretty new for me. Okay, कि बच्चा ऐसा भी कर सकता है कि they'll be hiding their pain or
Yeah, they do that a lot of times. A lot of times.
Okay.
If they've had a negative dental experience, they will go to any extent, more than what adults would do it. Because
Because
children's fear are, well, we don't realize as adults, but children's fears are rarely have a large dimension.
Of
They can make them
course.
do a lot of things we do not expect.
Right.
So let us not subject them to those fears and address them nicely only.
True. Undoubtedly, I think now here, वही जो why I always wanted to bring this up, because ये बहुत important है. And कहीं जब पेरेंट्स का रोल और एक डॉक्टर का रोल यहाँ पे जो एक और प्लस उनकी जो आपस में केमिस्ट्री है वो एक इम्पॉर्टेंट होती है, बिकॉज ये जो स्कार्स और वो जो डर है वो जो बचपन में बैठ जाता है ना,
Absolutely.
वो आई थिंक बड़े होकर भी नहीं निकलता, एंड यू स्टिल हैव दैट फियर इवन वंस यू ग्रोन अप एज वेल कि
Yeah.
डेंटिस्ट
It all starts there. It all starts there.
so it's that's why I always wanted to bring this up. And having you here, it was like, this is something I
Thank
really
you so
want to cover, so that now it is like अब बच्चे का वो डर भी अगर now that has subsided, so coming out to the next thing कि स्पेशली जब ज़्यादा प्रॉब्लम्स डिटेक्ट होती है एंड जो प्रॉब्लम है वो सिवियर हो गई है, किड इज़ आस्क्ड फॉर RCT, पल्पोटमी और मे बी एक्सट्रैक्शन, तो उसमें उसमें बहुत सारी एप्रीहेंशंस हम पेरेंट्स को ही पहले हो जाती है, इतना बड़ा इंजेक्शन लगेगा, एंड वो लोकल एनेस्थीसिया सेफ होता है नहीं होता, so वो वाला जो है ना, can you put some light on it, what how safe it is, and how scared a parent should be?
Well, dentistry has now evolved to a level that it is not really painful, right? It is not really painful. Most of the time, the child is crying not because of pain. He's crying because of the new things that has happened, that he wants. He's not in control of his mouth, that everybody is doing, that the dentist is doing something which he doesn't want. There is no pain. Even if we give local anesthesia, we have techniques, or we have the kind of needles and syringes we have. They are they're just not painful at all, right?
Okay.
So the child is able to accept them very easily.
Okay.
And even if there are certain other methods, sometimes we would want to, at some situations, we would sedate the child also, if we think that the child will not accept even a bit of just even like a mosquito bite, even if that might turn him panicky, right? So sometimes we would sedate the child also.
Okay.
So, and talking about root canals and pulpotomies, these are very regular procedures. They are being done because the child needs it, simply, right? And that is the best way out of the situation. That is the best. So the other thing is, if we do not do a root canal in that situation, we can just allow it to go bad. And if we allow it to go bad, it might turn into an abscess, an infection, right? And a swelling. The child comes later with the swelling on the face. Then we have to do a more difficult procedure. Then sometimes we have to extract the teeth when the child has a swelling on the face, which might be painful. So all these things can be easily avoided.
Yeah.
Root canal is a very safe, a very common procedure, routinely done on a lot of children.
Right.
And it heals uneventfully, right? Children don't even remember. And some I remember a small child, he was a 5-year-old child, he had needed a lot of root canals. And he used to speak in Punjabi, and every time he would come, "मैं root canal कराना है, मैं root canal कराना है, मैं root canal कराना है," and the whole dental office would be like this small child wants a root canal.
Okay, this is that's what I said. Yeah. No, कि ये कितना important है ये
So
वाला.
it is a very routine thing. There's nothing so difficult about it.
Here I want to share my personal experience. I think मुझे बिफोर इवन मीटिंग यू मुझे अपने बेटे के लिए किसी ने बोला कि इसका तो रूट कैनाल होगा एंड उसके लिए लोकल एनेस्थीसिया लगेगा, और LA सुन के तो मैं डर गई थी, एंड आई डिलेड going to a dentist thinking कि LA लगाना पड़ेगा, and
you're not the only one.
so now I felt I did really really wrong with him. So I really wanted you to come here क्योंकि मैंने बहुत सारी गलतियाँ करी हैं. I really want all moms out there, all parents around there कि वो गलती ना करे जो मैंने बहुत करी है, and उससे उसने सफ़र भी किया. उसका सिवियर हो गया एंड एक की जगह 2 रूट कैनाल्स बढ़ गए, यू नो. सो आई थिंक इट्स द इन्फेक्शन इन द
Yeah,
माउथ,
it is a
दैट्स
vicious
हाउ.
cycle. It's a vicious cycle.
या सो वही हम जो बचपन में पढ़ते थे ना, आई थिंक वही जो बचपन में बैठा था ना, वो बुक्स में पढ़ा, पोम्स में पढ़ा कि गोइंग टू अ डेंटिस्ट इज लाइक अ विशियस साइकिल एंड यू नो तुम फंस जाते हो एंड देन द अदर टूथ. सो आई हैड मेरा खुद का ही एक बहुत एक यू नो आई हैड क्रिएटेड दैट बाउंड्री व्हिच वाज वेरी, सो आई डिलेड coming to you. And then of course the RCTs happened, but then yes, now RCTs sound to be really normal thing.
It is a normal routine procedure. It's everyday dentistry. That's nothing so to be scared about.
Yeah, so
It's
I think,
very safe. It's very safe.
right.
And
I know.
some parents have this concern कि हम इस tooth में RCT कराएंगे तो permanent tooth को तो कुछ नहीं हो जाएगा. So it's not, I just want to clarify at this point that हम रूट कनाल ट्रीटमेंट सिर्फ इसी टूथ में कर रहे हैं, परमानेंट टूथ को हम नहीं छेड़ रहे.
Right.
इट इज ओनली दिस टूथ विच विल बी ट्रीटेड. दिस विल फॉल ऑफ एज अ नॉर्मल टूथ एंड द परमानेंट टूथ विल कम ऑफ इन अ नॉर्मल वे.
Yeah.
So we are just treating this tooth for the
Yes.
time that it is. We want it to stay till the time it is supposed to stay in the mouth.
Yeah.
And do its function. That's it.
इसी से ना एक और क्वेश्चन भी आता है, जब आरसीटी का नेम लेते हैं ना और एलए लगेगा तो घर वाले जो खासकर पुराने मतलब हैं जिन्होंने खुद कभी नहीं इनको ज़रूरत ही नहीं पड़ी, दे हैड अ वेरी हेल्दी डेंचर एवरीथिंग, नो. सो बट देन दे ऑलवेज से कि मिल्क टूथ ने तो भी चले ही जाना है ना, तो इसको क्यों आप लगे हो आरसीटी कराने, इतने वो सब कराने. सो हियर व्हाई आरसीटी बिकम्स रियली इम्पोर्टेंट दो वी नो इट्स अ मिल्क टूथ.
So, see, we would be doing RCT in a particular indication. We wouldn't be doing RCT for every tooth.
Of
Only
course.
when the cavity has reached a stage where the pulp or where the nerves of the tooth get affected, if we do not clean that portion of the tooth, it is likelihood that it will develop into an abscess. Abscess meaning that will be pus collection around the roots of the tooth,
Okay.
which is going to be more painful.
Right.
Which is going to be more. Why do we want the child to go through those episodes of pain? In rare cases, it goes to such extreme levels that the child has to be hospitalized.
Oh.
And he would be needing intravenous drugs for that. In rare cases, it can lead to that. But after all, it's an infection in the body.
Yeah.
Right? So why would we want it to reach to that stage? When RCT is a single sitting procedure, right? The tooth has to be numbed. It would take just 15 to 20 minutes, maybe sometimes half an hour, depending upon the child's cooperation.
Right.
Can easily be done, right? And the child goes home. He can go to school after that next morning. He doesn't need to take anything off. There's just few precautions which we always tell after doing a root canal. What the mother has to take. Nothing more than that.
True.
So
Exactly. So I brought up this discussion because मेरे मन में भी हुआ था and then it has become normalized by now. But I wanted कि बहुत सारे parents के मन में भी ये अभी भी हुआ है.
Yeah,
and
it is there. Yeah.
So,
a lot of parents when even now we suggest कि root canal होगा, they would look at us like this, that हमने कोई बहुत बहुत बड़ी चीज बता दी. It is just, and once they get it done, they realize कि so 15-20 मिनट में हो भी गया. There's nothing so और बच्चे ने भी आराम से करा लिया.
Yeah. So, is there any other sort of preventive measures? जैसे कि what I heard and I probably read कि जो नमक salt water है उसके गागल्स कराने चाहिए बच्चों को. और
salt water goggles are not specifically for children. They reduce the inflammation of the gums, right? So that is, I would not say to prevent cavities, but just for the gums to remain healthy, it is a good idea to gargle or to rinse with warm water with salt added to it. But as far as cavities are concerned, nothing can replace good brushing twice daily, and that you take care of the frequency of sugars that you take during the day.
Yes,
Right.
I think
So
by default, coming to that,
yeah,
because I think I wanted to
everything
shift
is
to
related. So
of course.
So it is the two changes that I would always advise to parents who come with children with cavities. One is brushing twice daily with a paste which contains at least 1,000 parts per million of fluoride, right?
Okay.
It should contain 1,000 parts per million fluoride. And secondly, to reduce the frequency, not the amount. I don't say that इसकी बंद कर दो बिल्कुल चीनी या बिल्कुल बंद कर दो, because they're growing children, they need sugars, they need carbohydrates. But it should not happen that after every 1 hour, sugar is going in the mouth in some form or the other.
Right.
If we give child milk with sugar or milk with chocos or whatever. I'm not saying to stop that, but that doesn't mean that after 1 hour, if he demands a biscuit, you give him a biscuit that also contains sugar. Or
Right.
then there's a meal and milk में there is दही में चीनी डाल के दे रहे हैं, ठीक है. So have it in your mind कि
Be mindful about the
yeah,
sugar.
be mindful about कि एक sugar exposure हो गया. In any case, processed sugar is not healthy for the body. We all know it now, right? Especially for the teeth, it is the criminal.
Right.
Right? Especially if it is given very frequently. The problem here is the frequency.
It's frequency.
Because whenever there's a sugar exposure, the mouth becomes acidic or the pH of the mouth drops.
Okay.
Right? And it takes around 1 hour for the pH to come back to normal. So during that time, the teeth are likely to get caries or likely to demineralize.
Okay, right.
So, and the number of sugar exposures, you measure that you multiply by the number of hours. You multiply by, and so that means all throughout the day, the child's mouth is acidic. It is likely that the mineral from the tooth is coming out.
Right.
So that is why we say to reduce the frequency. एक sugar exposure हो गया, उसके बाद next meal के बाद sugar exposure दे दो, बीच में मत दो.
राइट. एक तो वैसे तो फिक्स्ड ही रखना चाहिए, बट देन अगर ऐसा है कि एक्सपोजर ज़्यादा है या वो बहुत फ्रीक्वेंट है, तो बी माइंडफुल अबाउट एंड वो गैप्ड हो अच्छे
and
से.
so just look at your child's diet. हम अपने आप को सुबह क्या दिया, वो ब्रेक में उसने क्या खाया, रात में आके क्या खाया, उसमें कितने शुगर exposures हुए. A lot of times we think कि all this is we are giving the child healthy food, but we have to be mindful about it.
Right.
कि शुगर्स कितनी बारी गए हैं,
बिल्कुल.
एंड रिड्यूस दोज थिंग्स ओनली, एंड दे आर वेरी इजीली डूएबल. ऐसा नहीं है कि हम बहुत ज़्यादा सिग्निफिकेंट चेंजेस करने पड़ेंगे हमें बच्चे की डाइट में. जस्ट रिड्यूस द नंबर ऑफ शुगर एक्सपोजर्स, द चाइल्ड ब्रशेस ट्वाइस अ डे एंड रेगुलर डेंटल विजिट्स. इट्स एज सिंपल एज दैट.
I know it is
It
sounding.
sounds simple, but a lot of people find it difficult to follow.
But yeah, but actually they are doable.
They
ऐसा
are
नहीं है
doable.
कि
They
ये
absolutely.
नहीं हो सकता. It's like we parents just need to be more mindful about.
Absolutely, very
Yeah.
correct. It has to be.
Yeah.
It's a mindful decision.
Yes. Many a times, especially in a joint family setup होता है ना कि बच्चा कहीं भी और जा रहा है, कभी दादी के रूम में
Yeah.
क्या वहाँ लड्डू खा लिया,
So
then goes to
yeah.
another room, वहाँ से कुछ उठा
Right.
लिया. वहाँ पर भी I think we just need to be more mindful, and I think we are doing this discussions as an awareness.
As an awareness. So
ठीक
the
है ना?
awareness and just not has
So-
to be for the mother. In the Indian context, it has to be for the entire joint family.
family for that matter. Yes.
Because here in India, the child is brought up by the entire family, not just by the mother and the father.
Yes. So I think this message has to go across by the parents to the other family members as well. So मतलब ये आपने ना बहुत अच्छे से डिटेल में ही कवर करा. I was about to ask you वही कि क्या खाना चाहिए और कब खाना चाहिए, बट आपने बहुत ही अच्छा सोल्यूशन दिया. जस्ट बी माइंडफुल अबाउट कि शुगर दिन में कब गया. टेक अ नोट ऑफ इट बेसिकली एंड देन टेक required steps.
And another thing you talked about कि क्या खाना चाहिए, क्या नहीं खाना चाहिए. Carbonated drinks should be avoided, right? Because they further lower the pH. They are acidic. So for
Right.
children, not too much of carbonated drinks. Yeah, that we should be mindful about.
Yeah.
They're not in any case healthy. And
Of course
for the
they
teeth,
aren't.
we all know it. If for the teeth, for a child who is prone to cavities, it will only make the situation worse.
True. Undoubtedly. I think ये सब बातें ना हम parents we know, but at times we need a reinforcement.
Yeah.
That's why हमें पता है कि बच्चों को चॉकलेट्स नहीं ज़्यादा देनी चाहिए, है ना. फिर वो कई बार फ्लो में आता है, मे बी कोई पार्टी आ गई है, कुछ ओकेजन आ गया है, but
Agreed.
then
But if the reason is correct, is you are aware of the reason,
Yes.
then you will be more clear about why you're doing it,
Exactly.
and you would be wanting to do it as and when required.
बिल्कुल. So that's why ये जो आपकी तरफ से जो reinforcement है ना, ये बहुत important है. So thank you. I was seeking for it for that matter as well. So now it's like I'm taking it as a journey, है ना. So बच्चा को सबसे पहले पेरेंट्स को प्रिपेयर करा कि लेकर आना चाहिए. आपने उसमें हमें बताया कि नहीं जूठा खाना नहीं चाहिए और सेम यूटेंसिल से नहीं खाना चाहिए. Then preparing parents and kids mindset while you are there in the in the clinic, and then what all the preventive measures, है ना. So now I want to come over the misconceptions वाला thing कि कौन से prevalent misconceptions हैं जो बहुत है, when you come across almost daily कि parents think like that but actually ऐसा नहीं होता. तो what जैसे मैंने भी कहा कि हाँ LA देना harmful होता है, मतलब बच्चे को बहुत ऐसा लगता था. So,
LA is not harmful at all. Local anesthesia is one of this. It has been, in fact, it was introduced to the world of medicine by a dentist only, right? I'm just
Wow.
just a fact.
Yeah.
So it is. We do it in the right amount of doses. It's like any other medicine. हमने पैरासीटामोल देनी है, so ऐसे नहीं कि हम उसको एक particular dose में ही देंगे ना. Similar, it is absolutely safe. It's only
Right.
because the child needs it we are giving it.
True.
ठीक है. Similarly, when we are giving, we are well aware of what is the dosage, correct dosage for the child to be given.
Right.
And it has tested, it has lasted for, there has been no untoward reaction or risk involved with local anesthesia in so many years. It is one of the safest drugs that we've had.
True.
One of the safest drugs, because no dental procedure, the dentists have, I think, must have used buckets of local anesthesia by the, and none of the patients, it is just so momentary, it is just so reversible, it is only meant for a particular period, and after that, once the anesthetic is absorbed into the body, it just does not exist.
It's like
No,
a normal
it
thing.
is only to make the child or whosoever is taking it comfortable.
Right.
That is the only idea.
Yeah. Now, other misconception is like X-rays बहुत होते हैं, you know, dental X-rays. The way वो भी एक
Now, sometimes we think that maybe so much of radiation is not. So, modern radiology in children, most of it is digital. Now, what was traditionally the dosage has now reduced to 1/10.
Okay.
So, if I talk about like maybe 25 to 30 years back, whatever radiation was required to do an X-ray, it has reduced to almost 1/10 of that now.
Already, okay.
Already. So we use very, very minimal radiation, right? Because everything is digitalized and we now no longer use the regular films. So the radiation required for that is very less, right? And saying that, it is not that I say that yes, हमको repeat करते ही जाने चाहिए dental X-rays. Radiation is cumulative and unnecessary exposure should be avoided, but that does not mean that we do not do it where it is required. Right? In the Western world, right, it is very common to take radiographs of all teeth, irrespective of the fact whether the child is in pain or not in pain.
Okay.
Of all teeth. All the teeth, just to see if a cavity has started or not started.
Okay.
Right, because it is visible more easily in a radiograph. This is not prevalent
sort of a
in
protocol they follow.
Yeah, it is a protocol. It is a recommendation.
Okay.
That all teeth have to have X-rays for all the teeth.
Okay.
Irrespective of the fact whether he has a problem or he doesn't have a problem.
Okay.
Then it has to be repeated after specific ages. Right?
Okay.
So these protocols are recommended only after a lot of research, only after being sure that there is no harmful effect of it.
Yeah, so they are safe.
It's absolutely safe.
Yeah. And so now coming on to the other, thumb sucking.
Yeah.
So thumb sucking is like बहुत जो बच्चे करते हैं पेरेंट्स को डर भी लगता है कि टीथ बाहर को आ जाएंगे, but what exactly it is like?
So I'll explain this to you that, see, thumb sucking is actually a normal drive in every child. When the child is born, when he's an infant, the only sensation that is the only part of the body which is most developed as far as sensation is concerned is the mouth, because he's feeding from the mouth. Rest of the sensations are not as developed. So he derives satisfaction out of sucking something from the mouth. Right? And this is when if this thing goes on for a long time, that is when maybe a problem starts. But it is not abnormal from the beginning.
Right.
It is not that if a very small child, if a 2-year-old child would occasionally suck his thumb, that we need to be really getting worried about it.
Right.
Right. So, but yes, parents sometimes get really worried, right? That especially they come to me कि ये तो अभी से अंगूठा चूसने, जब दांत आएंगे तो इसके दांत बाहर आ जाएंगे या पक्के दांत बाहर आ जाएंगे, and they get really worried about it and start scolding the child or being very strict with the child. Now what happens is कि बच्चा फिर आपके सामने तो नहीं करेगा, पर छुप के वो जरूर करेगा, because this has become his psychological need. In the times of stress, we have seen lots of kids एग्जाम टाइम में थम सकिंग ज़्यादा हो जाती है, बाकी टाइम में इतनी नहीं होती. That is because he derives some satisfaction from it.
Right.
Right? So what I would advise is that, what I would want to say is that if your child indulges in thumb sucking, do not scold the child.
Right.
Distract him to the maximum. Right? If he's enjoys dancing, if he enjoys listening to a song, engage him in a conversation. Right? That way distract him so that he finds something which is more enjoyable than sucking his thumb. But if you tell him कि तूने you don't have to do this,
वो और करेगा.
ठीक है, आपके सामने नहीं करेगा, but you are not watching over the child all the time. He's in the bathroom में there are a lot of children who suck their thumbs in the bathroom, unaware that parents को पता ही नहीं होता. The parents are unaware of this, right? So but seek professional help for this. Seek the right advice. At some stage, if this goes on for a long time, he would need intervention. If it goes on for a few years, that means it is being stretched a bit too far, and he needs intervention in the sense sometimes we would place an appliance in the mouth or place something in the mouth so that the child does not enjoy thumb sucking and he leaves it. These are habit-breaking appliances, very routinely given again, right? Typically given 5 years and above of children when the permanent teeth are about to come. Okay. Yes, so because if at that stage the child is vigorously sucking his thumb or any other digit, sometimes not necessarily the thumb, right? The teeth would have some force and they would tend to come out. They tend to be proclined.
Right.
And so it is not a completely incorrect conception that the teeth will come out, but we need to be knowing that what is the best way out of this, right? We should not be really scolding the child.
Right.
We should be distracting the child, and we should seek professional help. They should know, the dentist would know when to intervene and when not to intervene. Sometimes they would say, no, it is okay, we can wait for some time.
Right.
But at some stage, we would say, no, this is the time when something has to be done about it. Otherwise, later on, there'll be a bigger problem.
Right. I mean, yeah, this is because thumb sucking is definitely a problem in many households for that matter, but then yes,
some parents get really worked up with this कि उनको हर तरफ से पेरेंट्स को डांट पड़ती रहती है कि वो कहते हैं
I think वही जो पेरेंट्स को स्ट्रेस मिलता है वो बच्चे पे चले जाता है फिर, and or I think it's like sort of a vicious circle which they fell into, a trap sort of thing. So now it is like coming on to that permanent tooth, they start emerging. तो अभी ना बिकॉज हमारे भी घर में अराउंड बहुत सारे सेम एज के बच्चे हैं वेर उस एज में जहाँ परमानेंट टूथ टीथ आ रहे हैं. एंड व्हाट वी हैव ऑब्जर्व्ड ऑफ लेटली, जैसे हमारी एज थी तो टीथ तो जो थे वो जनरली अलाइंड होते थे. अभी बहुत आगे पीछे होते हैं परमानेंट टीथ में. ये एक शिफ्ट है, ये जनरली आपने भी ऑब्जर्व करा है कि जस्ट मेरे मिसकंसेप्शन है?
No, it is not that. It is. It has this thing, as what you're talking about, has happened over thousands of years. But I would not say that it would have happened between your generation and the coming generation.
Okay.
So probably we notice it more now, right? Because we are, as a society, are more aesthetically conscious now.
Right.
So a small malalignment which trouble us more at this stage than it would have troubled us maybe 20 years back. Right. Now there's nothing wrong about it. There's nothing wrong. Every child deserves a pleasant personality. So if there is some malalignment, it has to be intervened. It has to be tackled at the right stage.
So when is the right age? जब सारे permanent teeth जो
usually that is the right age, but sometimes we have to intervene earlier also. Some problems might need an earlier, they might show better results if they're intervened earlier.
So
it is case to case. So only on that particular case we can advise. There's no general this thing on it.
So yeah, there is no general thing कि अगर जो permanent teeth आगे पीछे हैं या different directions में है वो कब treat होने चाहिए, something which a doctor will decide according case to case, right? Accordingly.
That's right.
So so that's again a take home, because ऐसा नहीं है we should wait for all teeth to come and then go to a doctor.
In a lot of cases it does happen. The doctor does advise that we will wait for a few
that
years,
is
but not in all cases. Not in all. Sometimes it is not just the tooth position discrepancy, sometimes it is the jaw position discrepancy.
Oh,
Some
okay.
jaws are placed far behind. So there we might need to be doing something so that the placement of the jaws becomes correct.
Right.
So if you're getting a regular dental checkups, all these things will be sorted.
Oh, been sorted. Yeah, right. True. So अभी so बच्चों का क्या होता है ना कि स्पेशली द फ्रंट परमानेंट जो टीथ हैं वो आने शुरू हो जाते हैं पहले सबसे
Yeah.
पहले एंड किड्स आर वेरी प्रोन टू फॉलिंग एंड इंजरीज और वो खेलते हैं बिकॉज दे स्टार्टेड विद द साइकिल्स एंड एवरीथिंग दे टेन टू फेल डाउन व्हाटएवर द रीज़न बी जो एक्सीडेंट्स होते हैं और कहीं ना कहीं कितनी बार ऐसा होता है कि उनके जो परमानेंट टीथ है या टूथ है कोई वो इंजर हो जाता है या टूट जाता है ऐसे केसेस में व्हाट a parent should do at that moment,
Okay.
basically.
So it is a very important topic. I'm glad you brought it up because this is a dental emergency.
Okay.
Right? So it is very common, especially in 8 to 9-year-old children. The permanent teeth have just erupted, and because at this age children are into a lot of outdoor activity.
Yes.
One slip and one knock, and the tooth, because it is not even fully developed at this stage, it doesn't have a long root. One knock and it will be out. Right? Now, this was a permanent tooth. It was supposed to last for life.
Yeah.
And it is a front tooth. It has a lot of importance in the personality, in the aesthetics.
Yeah.
Right? So it has to be tackled immediately. Now, first thing that we need to be doing, that whosoever people are around the site of the accident, look for the tooth. Of course,
Okay.
bleeding, there's a lot of bleeding. There's going to be some amount of tension. And after ensuring that it doesn't have a head injury or he has not been critically injured, if just the tooth has fallen out and there's some other injuries. So if the tooth has fallen out, look for the tooth.
Look out for the tooth.
Look out for the tooth.
Okay.
Right? And immediately rush to a dentist. If it might take some time, then clean the tooth in running, not vigorously clean the tooth, just put it under some tap water or something so that there's no muck on the tooth. There's it might be on a ground or a soil which might be infected, right? So there's no muck on the tooth. Place it in milk. Milk is something which is commonly available, right?
Of
Cold
course.
milk, normal cold milk. Place it in milk and go to a dentist. The dentist would place it there and splint it. And a lot of times that is what it is required. The more we delay, we decrease the chances of the tooth being adapted back into the mouth.
Okay.
So the duration is very critical here. That is why I'm saying this is actually an emergency. We do not delay. If it happens at a time when the dentist is not available, somehow make the dentist available. Right?
Okay.
अगर 10 बजे चोट लगी है रात में, so you have to somehow make him available or rush to a hospital where they have 24/7 services. That this teeth needs to be re-implanted back
Okay.
immediately. And sometimes it happens, this accident would happen in school.
Yeah.
And sometimes we would just get a call कि उसके गिर गया, तो वो जब स्कूल से आएगा तो हम लेके आएंगे. No, don't wait for that time. Immediately get him and look for the tooth.
So here is a very, very important
Yes.
message, I think, for parents, for school authorities,
School
for
authorities
everybody
also,
who is
yes.
around a kid.
Sports teachers,
Sports
they
teachers,
are around
yes.
always,
Yeah.
right? Especially in some sports like when they're skating on a hard surface. These days children are a lot into skating on a hard surface,
Yes.
right? One slip and the tooth is gone, and then the person who is taking care of you at that time or supervising you at that time needs to be knowing what has to be done immediately.
Right.
It should not be that कि inform करते हैं, जब तक वो inform करेंगे, वो decide करेंगे. It has to be tackled immediately. Immediately.
And वो टूथ उठाना बहुत ज़रूरी है
ये
according
वो
to
टूथ उठाना बहुत जरूरी है. ठीक है?
Right.
Just pick up.
And-
Even sometimes it's a broken tooth also.
Yes, I was
It's
about to ask
it was not a complete tooth, it's a broken tooth. And
Yeah.
sometimes in the confusion, we might not realize it's a complete tooth or a broken tooth. In any case, get it. A broken tooth, a part of the tooth, a lot of time can also be attached to the remaining tooth in the mouth. Right?
Okay.
But a tooth which is completely knocked out also, from there it is even more critical. If it is, because there the root has to reattach back to the bone around the tooth.
Right.
There we need not waste any time.
Oh.
There it is very, very important.
Yeah, that's an important
Yeah.
piece of information.
Just look for the tooth, put it in the milk. If you can wash it, wash it. Even if you don't wash it, it is not as critical. But don't let it go dry. Don't let it go dry. Better to put in milk than in water. because milk has better osmolarity, right? So better to put it in milk than in water, and rush to a dentist, right?
Okay.
An ORS solution which we use can also be used, but I believe milk is more easily available.
Of course. And in case कई बारी because I think ये एक इंसिडेंट हुआ अभी अभी recently हमारे पीछे, तो वो टूथ ही नहीं मिल रहा, you know, वो पता नहीं ऐसे जोर से गिरे और हम सब लगे हुए ढूंढने, हमें वो टूथ नहीं मिला. So ऐसे केसेस में वापस क्या ट्रीटमेंट रहेगा?
Unusual कि टूथ नहीं मिलता, ठीक है.
It was a broken tooth, which
हाँ.
just छोटा सा piece,
Okay.
you know.
Yeah. Then there are lots of methods to replace, to rebuild the tooth. We can give, there's so many solutions to that. We can give a crown, we can do a build up, but can easily be tackled. In some cases, this tooth might require a root canal. In some cases, it might not require a root canal, depending upon the extent of the damage, right? That has to be decided case by case. But if we get it, there's no harm, and if we're able to attach it back, it'll be even better. It'll be almost like a natural tooth.
Oh wow!
It looks also better, and a lot of times we can, if we look carefully, we can make out whether it's an artificial tooth or a natural tooth. But if the natural tooth is attached back, nobody will be able to make it out.
Okay, true.
Because the aesthetics match so much with the next tooth.
Yes.
Right? So especially in the central incisors, if one tooth doesn't look like the next tooth, after some time the other person will be able to make out there's something wrong here.
Okay. So I mean, yeah, aesthetically, look wise as well, I guess. जो natural चीज है वही वापस लग जाए तो nothing like it.
Yeah.
Is it like that as well?
Absolutely.
Wow. Yeah, I think yeah, this was an important piece of information, I think, and everybody should know about it.
This is important.
Yeah. So it's like I just, you know, जो मेरे दिमाग में आई एज अ लेमैन, या मैंने जो फेस करा जस्ट अभी रिसेंटली, उसका टूथ मेरी नीज का ऐसे टूटा. सो एनी मोर मेडिकल इमरजेंसी वेयर, यू नो, एज पीपल शुड नो, बट maybe I'm not so aware as a question. I'm not so aware to ask about that question. Maybe you are facing on a daily basis, or maybe, you know, बहुत frequently up often you come across a situation which people should know. अगर ऐसे handle किया होता parents ने तो better हो जाता. So is there anything of that sort?
Like I said, the true dental emergency is like this only, but others a lot of times, I'm actually repeating it, a lot of time mothers come to us and with a lot of cavities in the child's mouth, and we tell them it might have happened because were you feeding the child in this particular manner? They said yes, we were doing that, and we are still doing that. And so all this the child will have to go through just because we didn't feed the child properly. Why didn't I know this before? It is, and they feel bad about it, and it is true. It is, had they had this knowledge, they meant everything good for the child. Nobody wants the child to go through through all these uncomfortable dental appointments, however uncomfortable we may make them. But at the end of the day, the child has to go through some stress.
Yeah.
So mothers would feel bad about it. कि हमें पहले क्यों नहीं किसी ने बताया?
Right.
So I would really want, if your platform helps me doing that, I'll be really glad that parent mothers should be aware that what is the correct way to feed the child, right? And that it can have ill effects also, right? Just by frequently feeding the child, yes, the pediatrician has advised it, you should be doing it, but also take care that you should be cleaning the teeth after the feed.
Right. This is really important.
This is.
And बच्चों को भी वो जो माउथ वॉशेस होते हैं, are they recommended?
Only if they are at an age when they would not swallow.
Okay.
Right.
So is there any
not before 5 to 6 years of age we would recommend mouthwashes for children.
So आपने बिल्कुल वो सही पॉइंट पे आए. You know, मदर्स को बहुत फील होता है जब देखते हैं कि बच्चे के माउथ में इतनी कैविटीज़ हैं, एंड द ओनली रीज़न वाज बिकॉज बेसिक फीडिंग का जो स्टाइल है वो करेक्ट नहीं था, एंड वी विश वी न्यू इट अर्लियर, है ना. सो एंड ऐसा ही कुछ ब्रशिंग के मेथड्स में भी है, मतलब इज देयर एनी प्रॉपर वे ऑफ ब्रशिंग टीथ मे बी वी नॉट एज अ mothers are always aware of?
Okay, so one thing that we should be knowing is that the child cannot brush his teeth properly on his own,
right,
till the time he's able to tie his own shoelaces.
Oh.
Matlab, till that time, his brushing needs to be supervised, right? The mother or the parent, whosoever is taking care, should be supervising in brushing. And when they start teaching the child, usually the mother in front of the mirror, the mother stands, or the father stands behind the child, holds the child hands and rehearses through all the motions, right?
Okay.
So the child has to be pointed out कि ये बाहर वाली साइड थी, ये अंदर वाली साइड है, ये ऊपर वाले टीथ को हम किल कर, अब हमने राइट साइड पूरी कर ली, अब हम लेफ्ट साइड पे जाते हैं, अब हमने अपर टीथ की राइट साइड पूरी करी है, अब हम अपर टूथ की लेफ्ट साइड पूरी करेंगे. सो मदर और द पेरेंट हैज़ टू, और द फादर हैज़ टू बी इन्वॉल्व्ड इन द ब्रशिंग प्रोसेस, राइट? एंड इट हैज़ टू बी कंप्लीटली सुपरवाइज्ड, बिकॉज इफ़ वी से कि जाके ब्रश करके आओ, तो ऑल चिल्ड्रन वुड की 2 मिनट ब्रश किया और बाहर आ गए, right? It has, and he doesn't have the manual dexterity developed till that age, till 5 to 6 year of age, that he can effectively clean, turn his wrist andar bahar upar niche. So it has to be supervised till at least 4 to 5 years of age.
Okay, so
It
that is important for me as well, I guess. You know, we were like कि 5 year plus हो गए and they're not good to go. वो अपना brush कर सकते हैं, but then
it has to be supervised.
right. And is there any particular way as well? Any strokes or something like that?
For children, we don't really advise very complicated strokes, but just a circular motion. A circular, sometimes when we're teaching brushing to children, we say make big circles in the ear, then make them smaller and get them close to the teeth till the time they make the circles in the teeth. Now circles on the front teeth, then on the back teeth, basically all sides need to be covered. So we won't go very particular with the direction of the strokes, because then children find it difficult to comprehend. For adults, we do that.
But if as a parent you are doing on your own, if you're not asking your kid to do it, but you take a brush.
Even then, you stand behind the child, hold the child's hand with the brush, and then make small circular movements on the front teeth first, front upper teeth, front lower teeth, back side of the teeth.
Right.
Then go to the back teeth. There also has 3 sides, outside, inside, next to the tongue, next to the cheek. So it takes time to do that. It takes time. So only after some time will the child himself realize the value कि शायद मेरा वो teeth वो side रह गई या मेरा वो करना था. So if you start with this habit at this particular age, it will stay with the child.
It was a big take home from me as well, I guess, because I think I was under that impression, you know, ki now they're 5 plus, so they can brush on their own. But I think I probably need to correct this part of me for that matter. Yeah, thank you for bringing that up and explaining it so beautifully. So I think हमने ना बहुत step by step और beautifully from starting जब baby born होता है वहाँ से एक जो care चाहिए होती है, and then प्रिवेंटिव मेजर्स क्या है, मिसकंसेप्शंस क्या है, देन उसको जब डेंटल अपॉइंटमेंट पे लेकर जाना है, देन उसके जो एडवांस ट्रीटमेंट्स हैं, आई थिंक हमने, एंड देन यू नो व्हाट सॉर्ट ऑफ ब्रशिंग शुड बी डन, डाइट में कैसा रहना चाहिए. आई थिंक यू ब्यूटिफुली एक्सप्लेन्ड ऑलमोस्ट एवरीथिंग. सो लास्ट कोई ऐसा मैसेज बिफोर, बिकॉज टुडे इट्स योर शो, नो, सो टू द ऑडियंस इन लार्ज, टू पेरेंट्स एट लार्ज, बिकॉज ये जो एपिसोड है ना वो लार्जली बच्चों पे फोकस्ड है, यू बीइंग पीडियाट्रिक डेंटिस्ट, एंड आई एम श्योर बहुत सारा केयर और यू नो थिंग्स प्रॉब्ली हम पेरेंट्स को भी चाहिए, maybe as a lot of things we are doing wrong as well as adults, but I think this particular episode is predominantly is for kids. So any message for parents you want to give?
Yeah, the most important thing I would like to say is that don't wait for the child to be in pain to visit the dentist. Don't wait for that moment. The child needs dental care before that, needs dental advice before that. Right? And yes, milk teeth are very important. This, as a society, we should be changing our concept that milk teeth are going to fall off. They don't need as much care. There is nothing far from truth about this.
Right. So I think I need not to repeat, because you very beautifully explained abhi ye jo aapne jo message diya, and thank you for putting it across. I think ये बहुत बड़ा myth और misconception है. Even मैंने भी hold on to करा है इस misconception को काफ़ी लंबे टाइम तक, and I really want कि it should spread across, and मेरे जैसी गलती नहीं सब करे. So then thank you for coming here, giving your valuable time and amazing insights. A lot of take homes for me, which probably I'll bring in change.
It was important for me also, because I wanted to tell this to a lot of people, and if I am getting a platform to do that, nothing like it. Thank you so much.